Yeah, and I'm going to go ahead and start the recording. That way it'll be sure that the total mics will count. Now I see, I think I see RADA on here twice.
Yes, because I'm using my phone as well to access the audio.
So which do you want me to put on as the host? The telephone or the computer?
The computer.
Are you telling me?
We need to mute everybody.
All right, I will mute it. All right, I've muted everybody just so that we can make sure we control the background noise. My name is Dr. Michelle Farmer. I'm the past chair of NCD Child, Chief Medical Officer for Advancing Synergy, and I am helping Ferdinand to conduct this webinar. Okay, I'm muting everyone just so that we can make sure that we can control the noise a little bit. And Ferdinand, I'm going to make you host. I'm just looking to see where I can find you as just your computer. One second. All right. Okay, I am going to make you the host. Let's see. Why don't you go ahead and start? Ferdinand, you can unmute yourself.
Perfect. Thank you so very much, Dr. Farmer. Before I start, I just want to invite those who are capable to rush over to the Facebook, and you can share. You can search Dr. Farmer or you search my name. I've already shared to my name, to my timeline, and to our page, to the RADA page. So you can actually go there and also share the Facebook Live so we could have more people joining and they can actually go through this session. We are expecting Professor Mbanya to come in as well. And so I don't know if Prof is already in.
I'm already there, Ferdinand.
Okay, okay. Welcome, Prof. Okay, I will go ahead and share my screen. Okay, great. So I'll just introduce this webinar. Okay. I think you can see me now.
Yes.
Perfect. So this I just want to take this time to welcome everyone, and we have a very, very simple agenda, which is going to be just the welcome to everyone that we have right now. Then we'll go straight to the introduction of speakers, and then we'll have the session, the COVID and mental health presentation, COVID and NCD's exposure prevention and care presentation. Then we'll have a quick Q&A, and then we'll have social media and mental health and substance abuse as the last two presentations. So this is actually the Youth and Mental Health Stressors in Cameroon webinar, which wish to really just appreciate everyone who has agreed or signed up to attend this webinar. And we know that clearly in Cameroon, life is almost on a downward trail because, and we see that for most youths, due to the current times, life is really hard. And so we are really happy to host this webinar. But what excites us more is at the National Youth NCD Action Network is the impact that we hope to have on all the participants that will participate. But the additional guarantee for our impact is really the fact that we have the honor and the privilege of very great speakers who have accepted to be with us today and to speak in this webinar. So we have support from the past chair of the NCD Chair, Dr. Farmer, here present. We have some of our friends from Ghana. We have some of our friends from Kenya as well, and India, and US, who are also supporting to make sure that we have this webinar go successfully. So I'll be further welcoming them in a moment as we go to the introduction of the speakers when I highlight the topics that they will take. So why we have this webinar is really because youth are those people that are at a stage of almost independence or autonomy. And, you know, we depend on some routines of life, like family life, school, jobs, our careers, our need to grow and to learn to become productive citizens. But when we have disruptions to these routines, such as you have in the current COVID-19 pandemic and even what we have in Cameroon, it's always because it looks like it's very uncertain for so many youths. And you know, we say youth of tomorrow. And so a group of people we really want to be able to look at. And we're focusing on mental health stressors because, you know, most of the times we
Ferdinand, you are gone.
Okay, we expected this. So most of the times we have to see someone on the streets before we can know that this person has a mental issue. But mental issues or mental problems start very young, and prevention is very important. That's one of the key reasons we have this session. So we want to be able to raise awareness of young people on the relationship between their mental health and some of the current multiple stressors that are present with us in Cameroon. We want to explore and some of those new mechanisms for which young people can navigate through this stress, especially those who are living with NCDs. We know mental disorders are already part of the NCDs. And so, but we also want to go ahead to examine the role of young people in reducing the negative impact of these existing stressors. So we are really happy for all that have been invited and those who have signed up to be here, because from the pre-survey, we realized that so many of you are actually those we can consider to be eligible to support the community to become better and to navigate these issues. So as I invite our speakers today, I just have the following things to note for us. So we would invite you to post your comments on the Zoom chat and we will respond to those comments. If there are questions, we'll put them together for the speakers to respond, so the panelists to respond. And remember, we are also live on Facebook, and we've had it shared. And so those who interact with us online on Facebook, they can also post comments that will be captured, and we can also pose questions to speakers if those questions come. So we also did a pre-webinar survey, and we indicated to those who participated in the preparations leading up to this webinar that when you come into the webinar, please post your email address on the chat section so that one of our team members can capture your email address and be able to follow up with your participation certificate that we will issue to you after you have taken the post-webinar survey as well. So, and so we would have definitely loved to organize this physically, but as you know, because of the same COVID, this is online. So we really appreciate your presence here. And lastly, I want to also appreciate the fact that some media houses saw this poster, and we reached out to some, and they wanted to see what we're doing and to see how they can cover this good news about what we should do with mental health stresses. So we're really excited about the presence of some of the media houses here. We have Abakwa FM, we actually have Equinox as well. So we want to give a shout out to them for seeing it necessary to look at the topic of this webinar to be so important that they can actually cover it and share the information that will be shared by our speakers out to others. So let me just introduce to you our first speaker of today. And our first speaker is going to be Nadege. Nadege, Anya Nadege is actually a psychiatric nurse by profession, working with as a mental health counselor and psychiatric nurse in the Southwest region. She's also the vice president of an organization in charge of funding in an organization called Healthy Brain Cameroon. So she has worked as a state registered nurse, and because of her great work, she was actually selected for scholarship by the Christian Blind Mission through the CBC Health Services, and went to school for psychiatric and mental health nursing in Calabar, Nigeria. She came back and she has actually done so much on mental health. She has treated about 3,000 patients with mental health problems, and she's established many support groups providing trainings also for nurses and many other people on mental health issues. So Nadege is currently supervising mental health work in the Southwest region, and she's also working with Doctors Without Borders right now on mental health issues. So I just want us to welcome her. Nadege, are you online? I'm going to be sharing my screen with your presentation.
Hello, I'm on. I'm happy to be part of the team. Thank you.
Great. So Nadege is going to be talking on mental health and COVID-19.
Hello, should I go ahead?
Yes.
Are you going to share the screens for me?
Yes. Screen has been shared.
All right, thank you very much. I will just go, okay. I think I will just go straight into the presentation. I don't know if my background is noisy. Or is everyone getting me clearly?
I think it's fine.
Okay. So I'm talking on mental health and COVID-19. We know the COVID-19 outbreak has brought a lot of fear. We can go to the next slide, please. It has brought a lot of fear in our country, in the whole world, and even to us as individuals. Fear and anxiety about the disease, especially for issues concerning our health and even the health of our loved ones. It's normal for us to be scared about issues concerning COVID-19. Reactions to stressful situations, they vary with individuals. We all have different ways that we react to COVID-19. We have different ways that we express our fears and our worries. It depends on how we think and how we feel. Now, COVID-19 is something that is still very unknown. There is a lot that has not been revealed about this virus. And so it has rendered us kind of powerless because there is a lot of information that we would have loved to have, a lot of things we would have loved to know if there is treatment, if the transmission measures are really very confusing. And this alone can cause instability in our mental health. Fear is actually something that is productive. It's meant to help us run away from danger. So fear is a positive tool. But when it becomes so much in such a way that we can no longer function well, it becomes negative. It starts producing negative effects known as anxiety. And that is what we are going to really talk about. People who have mental health problems are also having problems. They don't know if how is the other mental health problems, how are the medical problems, how are they going to manage it in situations like this? Are they free to go to the hospital? Are they of high risk? Where should they go to? How should they protect themselves? We hear some people die, some people recover. Are they one of those that if they contract COVID-19, they are going to die, or are they going to recover? All of these are problems that can really cause us to be mentally unstable. Equally, we live in a hot zone in the Anglophone section of Cameroon, the Northwest and the Southwest region. We have an ongoing crisis, and then COVID-19 has come to add to the crisis. This has brought a lot of instability in our state of mind. It's like adding on to the crisis that we already have. Okay. Next slide, please. Next slide, please. Hello.
You have the next slide.
Okay, thank you. There is a lot of, yeah, thank you. There is a lot of connection with how we react to COVID-19 with the way we think and feel. The way we think and feel about the present situation, about what is happening now, about the coronavirus pandemic, influences the way we act. We are all facing almost similar situation. We are faced with the coronavirus, which none of us ever expected, but we act differently. From the situation that is present, the way we think will influence how we feel, and it will influence what we do. For example, there is an example on the slide. For example, there is a news showing that there is no effort. There is a news showing national efforts to close the borders and saying everything is under control. In the town, no change has been seen. You're not seeing any change, but the news is saying that everything is under control. There is no clear information, and people continue to live close together with no access to support and the same issue as before. That is an example of a scenario that may be happening in the whole country. Now, there is a person A and a person B thinks differently about what they have seen in the news. A thinks that this is typical. The government has never cared about us and will not care now. We must protect ourselves. No one will look out for us. That is what A thinks. So how does it feel? He feels angry. He feels alert. He feels ignored. And then he has the need to act. So what does he do? He argues. He looks for the right information. He tries to speak out. Start finding rightful information, monitoring his environment to find out who could be ill, trying to protect his family. But see the way B listens to the same information. And what does he think? There is nothing I can do this moment. No one else is doing anything. Nothing will happen here. So how does he feel? He feels calm. Maybe uncertain. He minimizes the whole situation. And then he takes no step to protect himself. So we may all face the same problem, but the way we feel, the way we think, the way we feel influences how we act to that same problem. Next slide. Next slide, please. All right, I go ahead. Some people could have different feelings to the pandemics that we are having right now. There is uncertainty, there is fear and anxiety. Some people may even minimize what is happening and deny it. There could be hopelessness, anger and aggression, and recognition of hope. Now with uncertainty, sorry? We know that
Go ahead,
COVID-19 is
Nadege. Yeah.
attracting a lot of attention around the world, in our country. Significant aspects of the virus is not yet known. In addition to the deficit knowledge that we have, there is not enough information on COVID-19. We don't also know the restrictions, the protective measures that the government is putting in place. We are not very sure. We get different information from different angles. Some people say wearing the mask is protective, some say wearing the mask is more dangerous. So there is a kind of uncertainty about the information that we are getting. Also, where there is violence, there is conflict, there is poor health. We don't know where to run to. Some places, health centers have been closed. Existing health problems that we already have, people feel more worried about the increase in security. All of this is bringing insecurity, is bringing uncertainty. But the way we act due to the uncertainty will vary, just as I said. Some people, they may want to seek more information or may not even want to look for any information at all. Some may express fear, and they may express their ineffectiveness on how to protect themselves. People are wondering if they are ever going to get recovered if they become infected. Is COVID-19 ever going to be under control? Are there measures the government is putting in place? Will our communities get back to normal? These are things that we are not certain about. How do you react to all of this information? Are there things that are passing through your mind? Are there things that you are worried about? Are these the things that you are uncertain about? What is your reaction towards this uncertainty? It will vary with different individuals. For fear and anxiety, it is normal for us to fear because we are humans. Fear helps us to run away from a threat. If there is anything that is threatening to you, it is the fear in you that will make you to run away or to fight it. But for some people, fear may instead paralyze them, even stop them from taking any action. So how you react when you fear will depend on you as an individual. For some, they may not be able to sleep. Others may fear being separated from their loved ones. Some people fear being infected, falling ill, or dying. So maybe they may not go to the hospital at all because they fear contracting the illness. Some fear losing their income with their job. They can no longer go to work. Some experience some kind of epidemic, the other epidemics that have taken place before this one. And they are thinking or to even acknowledge that there is risk. You may have some kind of, you don't believe that there is. Bring some kind of relief to you.
Okay, Nadege, you can go on. Nadege, have we lost? I hope we have not lost Nadege. Dr. Farmer, do you think we have lost Nadege?
Yes, I'm checking now. I think we may have lost her. She's
okay.
She's still there. Wait, let's see. No, we may have lost her.
Okay.
Okay. Maybe
I think she's back.
She's back.
Yeah. So sorry, I was muted. I didn't know.
Okay.
Okay.
Yeah,
So I
maybe
said
she
some
can
people
press
could
back
feel
with this
hopeless,
slide.
they could feel helpless.
I think if
Yes,
we
go on, Nadege.
Sorry?
start with this slide, yeah.
Go on, Nadege.
So in some places, especially where there is extensive repeated violence, suffering, people may express feelings of no hope. You know, some people already had hopes that schools are recovering, schools are going back, and then COVID-19 has come to stop schools again. So it is reducing our hope or the chances of us recovering to normal. Some people may also feel helpless. They have lost power, they have lost control to improve the situation, and they don't see any help coming from where they expected help to have come from. All of this may have reduced our hopes. Some may even have anger or aggression towards the people that they feel that may have caused the problem, or the people that they feel that should have handled the situation. But yet, some people could have hope in the current situation. They know, they express frustration with the COVID-19, but they believe they will be able to overcome the disease. They are looking for information, although within limits. They try to continue normal lives. All of these are different ways that people feel towards the pandemic. The way we feel towards this pandemic is normal for everyone, but how we react towards them is what differs. It's what determines the state of your mental health. What are some helpful measures that you can implement to help you towards COVID-19? Allow yourself to feel the emotions. Identify the way you feel towards the pandemic. How do you feel? Connect yourself. Remember that strong feelings will always fade. So it is possible for you to have all these feelings, feelings of hopelessness, feelings of helplessness, feelings of anger and aggression. All of these feelings are possible, especially when there is a threat. When you allow yourself, you identify these feelings, you may be able to handle it. Or people who you can share it. You maintain your daily routines. What are some of the things that have changed with your daily routines? Try as much as possible to maintain the ones that have not changed, like getting to bed on time, respecting your meals, time for fun. When you feel out of control, it can really be scary. So try to get solid information about COVID-19 from reliable sources. For example, public health information. Reduce checking the news. You can set this even as a routine to identify when you are going to check news on COVID-19 and when you are not going to check news on COVID-19. Because news on number of deaths, number of infected people, this can really be distressing as well, especially when they are not reliable information. It is helpful for us to regain control because we had lost control. How can you do this? Setting your own goals. What are your goals? Some new activities that you can get yourself involved with. What are the new realistic activities that you want yourself? You are saving lives. So when we have symptoms and we stay at home, or when we are in quarantine or feel isolated, have this, remember that the reason why you are on quarantine is because you are out to save life. When you have the impression or the positive thinking that your reason for quarantine is because you want to save life, it builds your self-esteem and it motivates you to want to do this more. Try to remember that what helped you in the past when you were feeling stressed. We have all encountered stressful situations. What are the things that help you to overcome stress? Some of those things may be useful, may be helpful to implement now. If you use alcohol or drugs or cigarettes to forget stress, then it is not helpful. You may need to contact a professional. And if you get any of the symptoms, do not hesitate to call someone to help you. I will end by saying that if we practice the helpful measures, we will survive. Thank you.
Okay, thank you so much, Nadege, for those points. I would actually encourage everyone to post any questions on the chat. We are going to interact with some of your questions right after the next speaker, whom I'm going to introduce immediately, and whom he's a father to me, a mentor to me. He's someone that I had the privilege of meeting for the first time in my life after struggling to meet him for like 2 years. So I am extremely happy to introduce Professor Jean-Claude Mbanya, who is with us now. And I'd like to, with his permission, say a little bit about himself. He's actually a professor of medicine and endocrinology at the Faculty of Medicine and Biomedical Sciences at the University of Yaoundé. He's also the director of the Biotechnology Center and the postgraduate dean for the School of Life Sciences, Health, and Environmental Sciences in the University of Yaoundé 1. He has been one of the top voices on diabetes and other non-communicable diseases in Cameroon and globally. He's actually the honorary president of the International Diabetes Federation. And his output in research has been so great. He's had his work published in 27 international book chapters, and many peer-reviewed journals, more than 185 of them. So we have someone whom I think it's a big honor for us as young people to have him on board to talk to us today. And so I'll invite you to put on your listening, more of your listening skills as you listen to him talk to us about COVID-19 and NCDs. Always remember that mental health mental disorders are already part of the NCDs, and he's going to be expanding more on the other NCDs as well. So, Prof, welcome, and over to you. You can share your screen directly.
Yeah, you have to give me authorization. Yeah, thanks very much. Thank you for the kind introduction. I hear someone doing carpentry behind the scene. Are you hearing me? Are you hearing me? I hope so.
Yes, we can hear you, Prof.
So I'm going to be discussing COVID-19 and NCDs. What I've been asked to speak on is exposure, prevention, and care. I have no conflict of interest for this presentation. The learning objectives of my presentation are about fivefold. Know the epidemiological insights of COVID-19. Understand the links between NCD risk factors and COVID-19. And I'll use two typical examples of NCDs. One, you'll see a flagging slide on mental health, but I'll be dealing with diabetes and COVID-19, respiratory disease and COVID-19. Then I have a section on understand the prevention and care of COVID-19, and then the take-home message. If we look at the epidemiological insights of COVID-19, we realize that at diagnosis, over 80% of the cases are mild or moderate. 15% of them, even in our country, are severe, and 5% are critical. And disease progression, approximately 10 to 15% of the mild to moderate will go enter the severe phase, and approximately the same number, 15 to 20% of the severe cases will become critical. The average time from exposure to symptoms is 2 to 6 days. It varies now. We used to say 5 to 6 after infection. And the recovery phase is about 2 weeks. For symptoms to recovery for severe cases, it takes almost 6 weeks. And onset to death would take about 1 week to 8 days. And COVID must be, is less frequent in children, you see. And below here on this slide, you will see the mild cases, which I've just described, the severe cases, the 3 weeks, and after which either you recover or you are called by God to eternity. How long does the virus stay on surfaces? And these are important information if you want to think about prevention. And I think that's why I brought it out under the epidemiological insights. On plastic, it's about 5 days. On wood, it's about 4 days. On glass, 4 days. Paper, cardboard, 24 hours. Gloves, surgical gloves, about 4 to 5 days. Stainless steel, about 48 hours. Surface disinfection with sodium hypochlorite, which is like eau de javel, which is a diluted form, 61, 62, 71% bleach, with ethanol, would kill the virus within a minute. And then COVID was not included in this study, but to date, there is no indication that COVID-19 behaves differently. SARS-CoV-2 behaves differently from the other coronaviruses. And you can see that this information is from WHO. And how are patients, how is COVID-19, the 19 propagated? It has, you have a dynamic it's not dynamic, the determination is not well known. Transmission from person to person, right now we know it because there's community transmission. And then you have droplets, respiratory droplets, which would contact the surfaces and other people breathing. And I've talked about the incubation period, and I said 95% of the patients would have symptoms about 12.5 days. And this information is very important, that one person is susceptible of infecting about 2.6 persons. And you can imagine when you live in a community like ours where they are not social distancing measures are not being followed, and people are in bars and nightclubs, what actually happens. So you have coughing, then you have touching your eyes, greeting each other. So contact and surfaces would propagate the virus. And then from contagion, I've told you about you have no symptoms, which will go through. Mild to moderate, which is 55%, 30% with no symptoms. So especially in children, when they have COVID-19, they might not demonstrate any symptoms. So we should be very careful with children at home, because they will be the source of contaminant, but without showing the symptoms. People will show mild to moderate symptoms, about 55%, severe symptoms, 10%, critical. And this critical can go up to using in ICU and ventilators, and with the immune compromise, and eventually death, as you've seen from these slides. And these are all experiences that the Chinese had in Wuhan and the rest. I like this from a former British minister. He said, if you always do what you always did, you would always get what you always got. So times have changed, especially with COVID-19 in the air. We cannot keep on doing what we always did, because then we'll get more than what we wanted. What are the links between NCD risk factors and COVID-19? Here, I want to talk about increasing mortality. When you are increasing age, the gender, the males are usually more affected than the females, and this is from the Norfolk and Norwich Hospitals NHS Foundation Trust. Then you have ethnicity, when the blacks and Afro-Americans, the blacks are more affected than the Caucasians. Underlying comorbidities, and this is where we come in as NCDs, because you have lung disease, respiratory disease, diabetes, obesity, ischemic heart disease, and high blood pressure, which we can talk about cardiovascular diseases. These comorbidities account for a majority of the cases in terms of mortality, because the increase in mortality in many regions is due to the existing comorbidities, as I've said, mostly infectious diseases. Let us further examine these risk factors. And it's important to note that this is about 72,000 cases from the Chinese Center for Disease Control. Case fatality here was about 2.3%, which is like what we are having, more than what we're having in most African countries. In Cameroon, it's almost nearly 2 to 3%. And no death in 9 years and younger. So as we have mentioned, children are not usually affected, but they have symptoms. They don't have symptoms, but they can infect. 14.8% are in patients aged 80 years and over. Thank God that in Cameroon and most of Africa, very few people are above the age of 80, and 8% in patients between 70 and 79 years old. But what are the pre-existing comorbid conditions that would influence lethality, which is mortality? 10.5% cardiovascular diseases, 7.3% of all deaths were related to diabetes as comorbidity, 6.3% with chronic respiratory diseases, 6% with hypertension, 5.6% with cancer. And as you all know, there is a combination of most of these where people have diabetes plus hypertension or other cardiovascular diseases, meaning that in terms of NCDs, comorbidity with NCDs, people would tend to have adverse reaction. And I want to use these 7,162 cases with completed information on pre-existing comorbidity. I heard sister mentioning about in terms of depression, mental illness, chronic liver disease would account, as you see, non-hospitalization 59%, non-ICU 17%. Current smokers, you notice that smoking is extremely risk factors, not only for diabetes and NCDs, but also for COVID-19. Former smokers too, you can see chronic kidney disease, and most of the people dying also have some sort of chronic kidney disease. Immunocompromised individuals, you see it goes up. Cardiovascular disease, the majority of them, you see the percentages. Chronic lung disease, again, diabetes goes even higher, 42 to 19. And then other chronic diseases, as you can see here. And then you have no one or more of them, these, and then none of the above. So previous cases, pre-existing conditions have an deleterious outcome in terms of COVID-19 infection. What are the links between COVID-19 and NCDs? What we know so far is that people of all ages can be affected by COVID-19, but that the risk of becoming severely ill with the virus appears to increase for people above 60. That people living with a major NCD also appear to be more vulnerable to becoming severely ill with the virus, and that smokers are likely to be more vulnerable to COVID-19. And you would see, accept with me that these are very common risk factors in our society. Then I'll use two examples, diabetes and respiratory diseases. And some of these slides are from the NCD and WHO presentation when we had the NCD meeting, webinar. Diabetes affects about 500 million people worldwide, 6% or nearly 5 million in the UK, 1 in 4 in Pakistan have diabetes, and 20% in some Middle East countries have diabetes. What do we know so far about diabetes and COVID-19? But there are few reported cases of hospitalization, less than 35 in Wuhan or Italy. I can assure you that out of the 26 beds we have at the Hôpital Central, COVID beds that we have at Hôpital Central, 10 of the 26 cases have diabetes. The median age is about 66 years. Mortality is about 35% versus 20%. In non-diabetic individuals, an increase of 15%, and adverse related outcomes are that older age, cardiovascular complications, poor blood glucose control are all major risk factors accounting for mortality. And the threats are, we have now in my hospital, cancellation of routine outpatient clinics. There is remodeling of the space, so much so that I don't even have an office now. They're changing my office because they're transforming our large ward into a COVID ward. You have suspension of routine investigations like x-rays, suspension of non-emergency surgery, and all surgery related to transplant and otherwise have been suspended. How can COVID make things different? The presentation of diabetes emergency is worse. And then we have development of a typical type of diabetes post-COVID-19, and we have started seeing them. We've formed a registry in the world when we've started recording them. And then there's profound acidosis and ketosis, very insulin resistance requiring hundreds of units of insulin. And I'm talking here about diabetes ketoacidosis, atypical diabetes. This is due to the cytokine storm that makes them highly catabolic, and therefore these patients are very difficult to control. We have already heard about the impact of COVID-19 on people living with dementia and the rest and mental health, so I wouldn't go into that. What I want to go into these respiratory pathogens, we know that COVID-19 and respiratory pathogens, there's generalized lack of evidence that SARS-CoV-2 is new. COVID affects the lungs. It is expected that it would affect those with underlying diseases like TB, which we saw in China, smoking, which I've already shown you, asthma as a high as expected in early data, COPD, not as high as expected. Air quality too is, there's early evidence to hint that air quality has a negative impact on outcomes. And then immediate coordinated impact respiratory programs in low and middle income countries, removal of relocation of staff, which we are seeing in our hospitals, that even my diabetes staff have been relocated because we need more staff for the COVID ward, overwhelming of limited respiratory services, infection controls and lack of protective material for doctors and nurses and the healthcare team. And then we have diagnostic challenges and supplies because of COVID-19. And long-term impact will be future funding withdrawal from large donors that will go to COVID patients, national recessions with quarantine measures, modeling, suggesting half a billion people will be pushed into poverty. And this is very strange because the economies are being impacted by the COVID-19, and then no immunization, especially a rise in pneumonia cases. What do we know about prevention? But there are challenges faced by people affected with NCDs during COVID-19. Up to 60% of the health facilities are occupied by patients of NCDs, which is second to infectious diseases. Now with COVID-19, there is no more space. NCDA, like Cameroon, NCDA, National Address efforts to address the burden. And we have to think about our groups. We have diabetes, cardiovascular disease, cancer, mental disease, COPDs, kidney disease, sickle cell disease, which we have to take into consideration. And access problems, discontinued essential medicine, output in clinic and essential medicine shortages. I've seen some of my patients now rationing their insulins to make sure that it lasts longer. And again, they don't come to the hospital. So they come back, they come up now with foot ulcers and needing amputation and diabetic comas. And then challenges part 2, patients are frustrated. You've heard a lot of confinement, distanciation, long at these distances from hospital, economic challenges, depression, mental illness, costly efforts, traveling longer distances to get medicines, and then crowdsourcing and fundraising for essential medicine. Therefore, there's a lot of financial hardship now on our patients because the buying in bulk and high prices has become the norm. We've already heard about mental health outcomes with anxiety, disrupted support groups, and social support services like the church, where people used to go to every weekend or 2-3 times a week, and they'll find solace in worshiping and praising God. The WHO has brought out a few things about staying physically active, looking after your mental health, quitting alcohol, healthy parenting, and all of this can be found on WHO website, and we can all tease that. But there are other precautionary measures which we have been asked: washing your hands, coughing, how to social distancing, and then non-essential travel, it should be avoided. And then we need to break the chain. If you break the chain of infection, then we are going, I said 2.6, one person can infect up to 2.6 people. Therefore, if we break the chain, the infection chain will be stopped. And then COVID-19, we need a communication strategies, and there are 4 strategies: increase knowledge about COVID and NCDs, information dissemination, promote access and consumption of healthy foods, strengthening our communication networks and experiences, promote access to essential medicine and treatment, promote good mental and physical health by high-level advocacy in targeting policymakers, leveraging partnerships with critical region and global health institutions. Engage young people as key players in COVID-19, and that is why most of you are attending this meeting, because you are key players. I like this Ecclesiastes 18:19. Those of you who use the Bible, Ecclesiastes is not one of the Ecclesiastes. Before you speak, learn, and before you fall ill, take care of your health. We all have to take care of our health during this COVID period, because only us can avoid all the risk factors that people have. I don't talk about comorbidities because you cannot avoid them, but you can avoid contamination. I want to thank you for listening, and I have these take-home messages. COVID-19 infection is real. COVID-19 disproportionately affects the elderly and people with NCDs. Social, personal prevention, hygiene measures are important to prevent infection with COVID-19, and patients with NCD need special care in the management of that disease. I want to thank you, and to say that after the question and answer session now, I have to go because I have a project, an international project with about in 11 countries, and I'm in charge of the site in Cameroon. We start every Monday from about 5 p.m. Thank you for listening.
Thank you very much. Thank you very much, Prof, for this session. I will just go ahead, and I've seen some questions direct from the chat section, but I will just go ahead and give you a few, and also Nadege some of the questions. We'll just take two questions or so for now. So
can you take back the screen, please?
Okay. You need to stop sharing, I'm sure.
I have. Okay.
Taken?
Yeah. All right.
Okay. Okay, perfect. We have a question here. It says, so from Emanuela, a journalist, and she says, what factors promoting the recent boycott of public hospitals in Cameroon? What are the factors promoting the recent boycott of hospitals in Cameroon? This follows recent reports on cases of wrong COVID-19 diagnosis in the hospitals. I think in our pre-survey, we actually had more than 50% of people expressing concern about diagnosis on COVID. Prof, this is to you, a question.
I think it's not because people are running away. There are other things that COVID-19 in terms of symptoms, signs and symptoms, resemble many other infections. So when people come to hospital and they are suspecting that they have COVID-19, so they have to isolate them and do the test. And it's not the hospital's fault that they're false negative, because even the PCR diagnostic test is only about 70 to 80% right. And then the rapid tests, they have a fault of about 40 to 60%. In my hospital, my clinic, we have about 4,000 or 5,000 patients registered in my clinic in Hôpital Central, National Obesity Center. We have lost, to follow up, about 30 to 40% of the patients. One, because they don't want to come to the hospital and get infected. They think that when they say you are at the treatment center, if you go there, you can catch COVID from the air, which is true. It can come from droplets. So most of it is education, and the other one is fear. And fear is what is making people not to go to hospitals, so much so that some of them are coming in comas.
So the second question is whether children can actually be managed if they have COVID-19.
Yes, children are managed. We have a 9-year-old who had COVID-19 and we're managing, but they get out of it very fast. Why? I didn't want to go into the science of it. There's a certain home enzyme that you present in their stomach, which would stop the decrease of COVID-19 in terms of multiplication in your gut. Most of the children have that enzyme, and you are hearing the elderly, because when you are the elderly, you lose that enzyme. The second thing is that there is also, in terms of your immune system, the children have a better immune system, but when you are getting older, your immune system is compromised, so you have immunosuppression, and that's why immune suppressed individuals like those with HIV/AIDS can actually contract COVID-19 very easily.
Okay, so the other question, I think you had quite a good number. The other question is, nobody seems to be safe anywhere, like almost like there's no hiding place for anyone. And so the question is, how can youths be more, being someone who is directly into the scientific arm of ensuring that the world is safe or the country is safe, how can young people be of help mostly in this situation, in this period? What's your best advice?
I think the best advice would be that youth should first of all identify the elderly, their parents. They know that they can become infected and they have no symptoms, so they should not go near the elderly people. But more importantly, in terms of advocacy, if you look around in Yaoundé, we'll say it compulsory to wear masks. Most of the people who don't wear masks are youths. So youth should set the example by cutting the chain, by wearing masks, these social distancing measures, and rebuking those who don't do it. If you see all those people who are riding bikes and carrying 2-3 people on top of it, they're youths. Taxi drivers are mostly youths. So youths can be advocates for change. And that's what I expect from our NCDA, and especially the youths now. Our youths in this organization should be the one propagating more treatment for those affected with NCDs because they have a higher risk. So we should be advocates for these people.
Okay, so a couple of interesting statistics here. 80% of youths actually feel that they have not contacted anyone with COVID-19. And then in addition to that, we had another 38% that feel that their family members are unlikely to contract COVID-19. What do you think would account for these thoughts, and is this a threat to what we expect youths to really be as far as helping curb the spread is concerned?
Yes, I think as I said, the bad thing with youths is that they can have the disease, but they are symptomatic. So they will not even know that they have the disease, they're contaminating others. And then secondly, the youths are those who become even mildly, and they'll think that they have influenza. So what we should do is that we, the youths, and youths have no age, so I'm still a youth, what they should do is, as much as possible, ensure that they maintain the social distancing measures and respect them, because if they become infected, they might not have the symptoms, and the person who have the symptoms will be their parents, their uncles, their aunts. You'll be hearing about so many deaths recently and today again with Lawyer Sama. And then someone asked Ferdinand, if you can permit, about obesity being the major risk factors for diabetes, and how can we maintain physical activity amidst COVID-19. I have to tell the person that I have lost 5 kilograms of weight. I've been confined partially since March 17. I've lost 5 kilograms because I walk from my gate, climb the steps, and I do that every other day. Physical activity does not mean you have to go out of your house and be killed by a truck or a bicycle. It means that you can exercise even at home, even doing push-ups. So there are so many other things you can do if you have the willpower. I'm sorry I have to leave. The other side people are calling for me already. And I want to thank you, Ferdinand, and the rest for organizing this session, and everyone who has been associated with the success of this meeting. Enjoy the rest of the meeting, and God bless. Thank you.
Thank you very much, Prof. Thank you very much. We surely hear a shout out from the youths as they have listened to you. Thank you so much for coming.
Thank you.
So I'll have this question to Nadege. Nadege, we have had in the pre-survey that 49% who are listening to you right now have felt depressed and wish they were never born as far as this period of both COVID and the current crisis, socioeconomic crisis in Cameroon are concerned. That's close to 50% of youths are feeling this way. So what do you have to say to them about this kind of situation they are facing? Nadege, you can unmute yourself. Nadege, are you there? Looks like Nadege is not there. Okay, do we have any of, does any of the panelists have a point to make on this? Okay, so I think we will go ahead and try to see if we can bring in more questions as we save time. So I will just invite our next speaker, who is Sid. Sidat,
Hello.
I'm going to make sure that I make a good pronunciation. If not, you can support me. Sidat Sudakaren. Sidat is actually a friend of mine, and we were at the One Young World together last year at the UK, and he is very passionate about youth and mental health, and he's also the founder of Lone Pack and has been raising awareness on mental health in India. So we actually have Sidat here, and I'll just hand over to Sidat, and then he's going to bring us his presentation.
Thanks a lot, Ferdy. I'm so glad to be in the presence of all of you over here. So without much further ado, let me start off with the presentation. Ferdy, will you be sharing the screen, or should I share?
You can share. You can share.
Sure. I'm going to share my screen. Just give me a second, guys. Yeah, let me know if you're able to see my screen, guys. Shall I start?
Yes, we can see your screen now.
Brilliant, guys. So what I'm going to be talking about today is addressing the subject of social media and its effect on mental health. And why is this important in the current scenario, right? So due to COVID-19 and lockdowns and quarantines being implemented in various countries to prevent spread, what has happened is a lot of people are alone. A lot of people are in their homes with no access to any forms of entertainment or intermingling with other friends and family members. And so in this void, a lot of internet-based connections through social media becomes more and more prevalent. So this is important to address, right? COVID-19 already, as the previous speakers had mentioned, have caused a lot of effects on mental health due to facts like, let's say, the large unemployment that has led to a lot of stress among people, or the fact that they can't go out and purchase the commodities that they need, all this has already been contributing to the amount of stress being there in the post-COVID environment. And apart from that, the usage of social media is going to be another cause. And why is this the case? Let me address it here. So let us first think about, right? Like a lot of people say that social media is good. Some people disagree. They say that social media is good for my mental health. So let us look at it from a purely an upward perspective, right? Let's like go out and look what are the scientific studies that have been done and see what do they claim about why social media is either good or bad. Let's look at it. The study that I'm going to be talking about is one that has been done in the United States of America, where from 1976 onwards, they have been tracking the answers of high school students in the USA to particular questions. And these are the trends that have been observed, right? So one of the questions that they asked is, how often do you hang out with your friends? And the chart there shows the number of times the people answered, and it's varying across time. So if you look at the x-axis in the bottom, it goes from 1976 to 2015. And if you notice, right, in 2007, the iPhone was released. A lot of people in the US weren't accessing social media as often before the iPhone got released. After 2007, a lot more people, especially teenagers, got access to social media very directly, very often. And after the iPhone got released, the number of interactions with friends have drastically decreased. It's almost fallen to half. So there's a also another thing that I found is there's a very strong correlation between depression, between suicidal ideation, just thinking about committing suicide, and usage of social media. So what it means is, if a person is spending more time on social media, there is a higher possibility that they might have depression, that they might contemplate suicide. And these are very, very serious issues. Let me look at a couple more data points on the same studies, right? Similarly, they asked in the same study, they asked, how likely are you to feel lonely? Again, from 1991 to 2015, it's a very large time period that they've conducted the study over. But precisely at the point when the iPhone was released, which is when a lot of people started using social media, the number of people who said that they were feeling lonely increased dramatically. And this increase is very high, like from 25%, it goes as high to 33%. Similarly, one more thing that I'd like to say is, how likely are you to get enough sleep? Again, when they found was, once social media and smartphones and all these things became very common among young teenagers and young adults, it became much, much more difficult for them to get enough sleep. And we know for a fact, a lot of scientific evidence points to the fact that not getting enough sleep is one of the key factors contributing to mental health illnesses among all sections of the society, right? So these are three studies that I just want to highlight. And again, these were done in the US, but I'll let you know why I feel this would affect everybody in every other corner of the globe as well. So one of the things that comes up, right, like we say that Facebook, usage of stuff like Facebook and so other social media affect our mind. So why is it the case? What is the scientific basis on which we say that, all right, using social media is going to affect your mental health, right? So for this example, I'm going to consider Facebook because that's the one that is most widely used among the most sections of the population. But the same concepts apply to Instagram, to WhatsApp, to TikTok, or to any other social media application that you might be using. So think about, the slide that I'm showing, it shows two chemicals, serotonin, dopamine. So these are two neurotransmitters that are very, very important in regulating our emotions. So serotonin is called the happy enzyme. It kind of regulates how happy we feel, and dopamine gives us rewards. So it does a lot to do with our motivation to learn, motivation to do something, etc. So every time, like a very simple example would be, if you did your test well and you got, let's say, a very good marks, you'd feel happy, you'd feel a rush of happiness, right? That comes because dopamine is giving you that high. So these two chemicals are very, very important in balancing your happiness, in providing you motivation to do something, etc. Right? And both these chemicals are very, very badly affected, or the systems that regulate these chemicals are very badly affected by the usage of Facebook. So let me show you how this happens, right? Like very briefly. So how does Facebook trick your mind? So the previous two chemicals that I mentioned, right, the one that regulates happiness and the one that regulates our desire to, our motivation, etc. So Facebook, using of Facebook affects our brain's chemical networks, depending on these two neurotransmitters in these following ways. So Facebook uses our inherent biases, and I'll tell what those biases are and also explain how Facebook uses them, right? The first bias is social reciprocity. So we are built to give back to others. So for example, right, if we know that somebody has liked our Facebook post, we feel an obligation to thank them or to go to their post and like it. Or if somebody has commented on our post, we feel we have to like on their post, etc. Second is social approval. We are built to care about what others think of us. So I think all of you would have had this feeling where you put up a photo on Facebook, and if you get a lot of likes within the first half an hour, you feel happy. Or if you don't get enough likes within the first half an hour, you feel very anxious and you keep checking back again and again, and it affects your mental health, right? This is something that Facebook plays on. We always feel a need to feel approved by people. Usually it's very, if we didn't have Facebook in the offline world, how would we feel it? We'll feel it if somebody comes up to us and says, congratulations, you did a great job. But in Facebook, this is quantified. So Facebook shows how many people like your post, how many people love your post, how many people have commented. So all of this is very, very quantified and very easily, accessible. And apart from that, they also provide you a notification every time somebody likes a post. So all this, what it does is it makes our mind very, very attuned to what others are thinking of us. And this is naturally triggers our serotonin and dopamine levels, because we are humans are social animals, and we have this tendency to care a lot about what other people think. So, and third is social comparison. We always compare ourselves with respect to how our peers are doing. So how would that be? So earlier, like let us say I am Siddharth, I am living in India. I would know, let's say maybe 100 people in my social circle, and I would know how they're doing or something like that. But when I have access to Facebook, when I have access to Instagram or WhatsApp, all this stuff, right? I have access to thousands and hundreds of thousands of people online. I know how they are performing. I know the lives they're leading. They've got a new car. He's got a new job. She has got married. He has, bought a new house. All this stuff, it makes us compare not just to people in our immediate social circle, but to people across the globe. I will compare myself to people in the USA on Facebook, to people everywhere on Facebook. So it is very, very damaging to our social mental well-being, because social comparison can now be applied across the world, not just to people whom you know personally. And finally, novelty seeking. What is novelty seeking is, humans like situations that are new, in the sense that we like the thrill of the unexplored. So a lot of times, Facebook, the algorithms, how it is designed is, it keeps showing you posts that of people whom you don't know that you might like to follow. So as you scroll down the Facebook timeline, you are addicted to it because it gives you some new things that you haven't seen before, and you want to follow them, and you'll follow them. And when you are following them, you'll find something else that you've not seen before. And so this becomes an endless loop. So all these four biases, Facebook and other websites like Facebook uses them to disrupt our mental chemicals. And that is why we have a lot of serious mental health effects that I talked about earlier. Also, let me give you some very concrete examples of how it happens, right? So one of the simplest ways that all these sites do is, they make it very simple for you to log into Facebook. So I've given this screenshot here, right? So here what Facebook is telling me is, earlier I had to enter a password to log into Facebook. Now Facebook is telling me, next time you log in the device, just tap on your account instead of typing a password. So what does this mean? So next time, every time I have to type in a password, it takes me some amount of time, and this like reduces the possibility that I'll continue to log into the site. Instead, if I only have to touch a button, it becomes far more easier that I will be logging into the site, that I'll spend a lot more time on Facebook. That is one aspect. Similarly, another way is, they let you know that people have read your message. They let you know if somebody else is typing, they have a wavy dots coming up. All these things, what it does is, it plays into the second factor I told you about, social reciprocity. So you know that, okay, somebody else has read my message, so I will have to reply to them. Similarly, you feel that, okay, somebody else is typing for my message, let me wait until they complete typing. All these things are done so that you stay as much time as possible on Facebook. The more time you spend on Facebook, the more ad revenue they will earn. which is good for them, but it's not good for you because it will affect your mental health. And finally, one more thing that I'll say is a lot of people will say that, hey, Siddharth, I listen to what you're saying, but I still don't trust you. I think you have some bias against Facebook. I think you are against social media. That is completely not true. I understand that social media, including Facebook, have a lot of really good uses. Even now, we are broadcasting this live on Facebook. But Facebook, the overuse of Facebook or the abuse of Facebook has very serious concerns. Don't take it from me. Take it from people who have designed Facebook themselves, right? The person I'm showing in the photo is Chamath Palihapitiya. He was the former vice president of the user growth at Facebook. And what he says is the short-term dopamine-driven feedback loops that we've created are destroying how society works. This is said by the guy who built Facebook in the beginning days. And he says that I feel tremendous guilt for what I have built. Similarly, there's another person called Sean Parker. He was a founding president of Facebook. Now, listen to what he has to say. So he says that when they were designing Facebook, right, how they designed Facebook was, how do we consume as much of your time and conscious attention as possible? And so they basically want to say that you have set amount of conscious time. How can we consume as much as possible of it? So let's say if you're an average human being who sleeps 8 hours, 4 hours, does other stuff, you have like 12 hours of the day which are actually conscious. And they wanted to consume as much of it as possible. And it is already working because studies have shown that humans across the globe, they spend 4 to 5 hours of the day on smartphones and social media. Think about it, 4 to 5 hours a day. And like he said, every time we give you a little dopamine hit. So again, it's very important to know that these are not like random things that we're saying. A lot of times we say that all right, it's just my parents saying that Facebook and social media is not bad for my mental health. I won't listen to them. They're just like saying randomly. That might be true, but know that there's a lot of science behind it. Know that a lot of people are actively debating how they can be solved. And basically, the one thing that I want you guys to take away from this is restrict the amount of time that you spend on social media, that you spend on smartphones, because that is very, very, very detrimental to your mental health, especially in the time of COVID, where you're all locked in and where online media is the only way that you can access a lot of avenues. So how can you protect your mental health? So I'll just briefly go through this. So the first thing is, I think most of us have smartphones, right? If you have a smartphone, turn off all the non-human notifications. What do I mean by non-human notifications? So a human notification is when a person messages you or a person calls you or a person is directly reaching out to you. So for instance, if you get a WhatsApp message from a person, that is a human notification. If you get a Facebook notification stating this many people have liked, that is not a human notification, that is Facebook sending you something. So turn off all non-human notifications. So how do we do it? If you have an Android phone, you can go to the settings, apps and notifications, turn off all the notifications apart from the very important ones like phone, messaging, and maybe WhatsApp if you use WhatsApp for personal messaging. And make your phone display black and white. So this might sound very confusing, but I'll tell you the logic behind it, right? A lot of the modern phones, if you look at it, they're very colorful, they're very attractive, and they're built that way to sustain your attention. They're built that way to keep you hooked and addicted to viewing the phone and keep viewing it over and over again. So if you turn the phone display black and white, what happens is the color and addictive nature of this thing becomes much less clear. So you can try it out. Different phones have different settings, but if you are able to Google how do I set my phone black and white, you will be able to find for whatever phone, whatever model you have, Apple, iPhone, Android, whatever it is, you will be able to find it out. And restrict your home screen to everyday apps. What do you mean by that? So oftentimes when you open your phone, whatever apps on your home screen are the ones which are most likely to use. So consciously remove all apps from your home screen that are not rewarding for you. Like remove all social media apps, remove all apps that are addictive, etc. Like TikTok, Facebook, WhatsApp. Remove them from your home screen. On your home screen, only have apps that you use for productive purposes. And finally, if you have the latest version of Android, from Android 9, Android 10, etc., there's this app called Digital Wellbeing by Google. It is a very, very, very useful app. What it lets you do is let you set time for each app that you use on a particular day. So the screenshot, what I'm showing, right? It's shown on this day, I used 3 hours, 22 minutes on the smartphone, and on what apps I spent what time. You can set a time limit stating, I only want to use Facebook for half an hour. I only want to use YouTube for 1 hour. And every time the limit exceeds, you can't access the app for that entire day. This is a very, very useful app that I have found very useful in my personal life. And finally, that's it from me. But the key takeaway that I want you guys to think about is, in the COVID situation, a lot of us are going to be using online tools, especially social media. Using social media is not wrong. Abusing social media is, because the more time you spend on social media, we know that the higher chances of you having mental health illnesses, including depression and suicidal ideation. Social media is built to get you addicted to it. There are some ways in which you can reduce the level of addiction, and these I've shared on the slide. I'll share these slides with you as well, so that you can go through it and implement this in your everyday life. And finally, I'm very, very thank you all for having me over here. These are my contact details. In case any of you want to reach out to me, feel free to stay in touch or ask your questions. Thanks a lot, Ferdy, for organizing this, and all the participants and the panelists. Pleasure to be here. Thank you. Hope I not overshot my time.
Thank you so very much, Siddharth. I think what you said was really very important. You know, I actually set up one of those apps to manage your time. And it was interesting that I was able to know when I've used 1 hour on Facebook every day. And that kind of made me to realize, hey, I have to probably either turn it off or do something about it, because it will be like 1 hour gone. So that made me to make a conscious decision about how intentional I am on using social media and what I am using it for. So I definitely use social media a lot, but the key catch there is using it for the right purposes, and you gave very good tips there. And I hope that our participants who are also social media gurus were able to get that. In the pre-survey, we have had quite interesting statistics on social media, and that will be one of those questions to you. And so, but we will want to go to the next presenter, who is the last presenter for today, Chair Challote, and she'll be talking about substance abuse and mental health. She's going to present, and then we'll now spend the rest of the time to receive questions from the youths, and then we address them, and then we have a few other key and 2 or 3 key announcements to give for the youths before we depart. So I'm actually going to share my screen and invite Challote to start her presentation. Challote, are you there? Okay. Challote, if you are there, you can speak, and we can now hear you. Your slides are up. Challote, are you there? You need to unmute yourself.
I think we may have lost Challote.
She's in. Chair Challote, you're in. You need to unmute yourself.
Oh, yeah. Yes. No, I see her. Correction.
Challote, can you unmute yourself? Maybe I should just unmute her.
Yeah,
okay,
maybe if you unmute her, but I don't know. Sometimes I see her going in and out on our screen of participants.
Yeah, I think we.
Ferdinand.
Oh, I think we have lost her again.
No, she's back now. She's back.
Okay. So just unmute yourself, Challote.
Yeah, she may be having some audio challenges, Ferdinand. I apologize for any of the interruptions.
Okay, I think. Oh, okay. I think I'm unmuting her. I don't know.
Hello?
Challote, I've unmuted you. You can speak now.
Okay.
Your slides are up.
Good evening.
Go on.
Okay, good evening. Welcome
Yes.
to Cameroon, where technology is also a mental health stressor. I've been stressing up since to connect to the network. So we are having technology as one of our mental health stressor. Okay. So I'll be talking about mental health and substance abuse. Okay. There is a clear distinction between mental health and substance abuse. And a mental health, many people used to ask if we treat mental health in Cameroon and without talking about substance abuse, then we are having a problem. So it is unavoidable for us to speak about mental health and don't talk about substance abuse. Substance abuse refers to the harmful use of psychoactive substance, including alcohol and insulated drugs. In 2018, Cameroon Anti-Drug Committee, National Committee, says 21% of the population have already tried hard drugs, and 10% are frequent consumers, including 60% young people between the age of 20 to 25. What usually causes youth to get into drugs or substance abuse include trauma. Like now in Cameroon, we are having a problem within the two Anglophones region, which have speed up the rate in which people are traumatized. And from research, it shows 3 out of every home educated.
Well, looks like we have the stressor on technology playing out. So, okay, but Charlotte is still in. Okay, I think she's out again. So, okay. So I think we have a problem with sustaining chair in, and so actually we.
Can you take some questions?
Okay,
maybe for you by the time.
Yeah, maybe we could just take we could just start taking the questions that are going to Sid while Charlotte comes. So Sid, from our survey, pre-webinar survey, we realized that up to WhatsApp is the most used social media in Cameroon right now, seconded by Facebook, and we also had the interesting information, like 50% of users use social media between 1 to 4 hours a day, and 12% are using between 8 to 12 hours a day, and 24% are using between 4 to 8 hours a day. That seems to me, so you have close to 50% using social media 1 to 4 hours a day, youths in Cameroon. You have 12%, 8 to 12 hours a day, and you have 24% using 4 to 8 hours. Remember, this is just a pre-webinar survey. This is just those who responded, over 55 respondents. So what is your advice in terms of those? You have really spoken about those hours of use of social media in relation to addiction and mental health. And this is something so many youths are actually concerned about, I think. But it's very difficult to control oneself. But you had 66% who had a positive impression that social media has improved their overall quality of life. That was where I found it to be interesting. So you have close to 50% using 1 to 4 hours, but you have 66% of people saying they feel that social media has improved the overall quality of their life. I don't know whether this is based on the fact that they are able to get information on social media, whether they are able to get useful information on maybe opportunities. Please, can you speak to this?
Thank you, Ferdy. I think it's a very, very important question that you asked. Just to clarify, right? Nobody's saying that social media by itself is bad. Social media is a very useful tool. We're able to connect with people, run businesses, do a lot. Like a lot of my work itself happens on social media. I connect with people, etc. But what we need to be careful about is how much time we're spending on it. And coming to the point where you mentioned that those more than 60% had a positive opinion on social media, even though they were spending a lot of time on it. What I would say is this, right? So there's something, social media, we actually classify it as an addiction, like spending a lot of time on social media. So if you're spending, let's say, 4+ hours on social media, 2+ hours on social media per day, that possibly points to something called a social media addiction. This means that, and generally, if you ask an addict whether something is good for them or bad for them, they're not in a state of mind where they can analyze it objectively and say that, yeah, this is affecting me in some way badly. So just, I know that's not the same. I know it's not the same. So pardon me if I'm using this analogy, but I'm just like using this as a comparison, right? If you were to go to somebody who drinks every day and ask them, is alcohol good for you? They say that actually it makes me feel good. And that is true. It makes them feel good temporarily. Like how using a lot of social media every day will make you feel good temporarily. But over time, like if you use social media one day for 5 hours, it's not going to change. But if you keep using social media regularly for many hours every single day, that will affect your mental health. Reason being, it's going to take you away from other activities that you can do by mingling with people. It's going to affect your dopamine, serotonin that I mentioned, etc. So the key thing to know is don't remove yourself from social media, but be conscious of the time you're spending. And the simplest thing that I can tell you guys to do is remove all the apps from your phone. Like for example, Facebook don't have it as an app on your phone. Anything else don't have it as an app on your phone. The reason being, if you have it as an app on your phone, you're always online. Every time a notification comes, you immediately get a notification, you'll check it. Instead, only use Facebook through a website, through logging in through a browser. This means you will control when you're going to use Facebook. If you have it as an app, it will control when you will use it. Whenever the notification comes, you will be using it. If you are only going to use it when you log in, that is much, much, much better. The key thing is don't stay away from social media. It's very, very useful, but be cognizant of how much time you're spending on it. And always, like I said in the message, right, make sure you are using Facebook, not that Facebook is using you. I hope that answers.
Great. What a great quote to leave this place with. Make sure you're using social media and not social media using you. I want to live 90 years, up to 90 years old, and I don't think I want to be killed by social media. I want to make use of social media so that it improves my life, really. So thank you very much for that. I think we already have Challote back. And Challote, can you speak so that we know you're back?
Yes, sir, I'm back. Oh, God. All right. We're
So
talking about the causes
I'm sharing my screen again. Don't.
Okay. We are talking about the causes of substance abuse, and we already talked about trauma. So now we are going to talk about the environment in which we find ourselves. In our set in Cameroon, we always have a large family size, which is common to find a man getting married to 4 women and having 24 children. So this entails that parents tend to lose control over their children in some cases. And we also have a physical environment where it is common to find children hawking on the street, which expose them to other risk factors. And we have genetics causes, which in our own local setting, we will say a dog doesn't give birth to a cat, which means if your father is an addict, you are likely to be an addict. And we have another cause, which is a little or no education on mental health and substance abuse.
Thank you.
These sorry. Hello.
Don't worry, I'm muting. I think someone was speaking on the background. you can go on.
Okay, we have little or no education on mental health and substance abuse. A very good example I would like to quote is myself. While growing up, nobody ever taught me about substance use. Nobody ever educated me about substance abuse. So it is a cost that we can't actually control at this period of time, where we have knowledge and we have information concerning substance use and mental health. Another thing that exposes us or causes people to substance abuse is stress, especially the youth. But we are going to ask ourselves that what usually stress youth, you see them, they are looking all well dressed up and doing all sort of things, looking okay on social media, but what is usually stressing them up? In Cameroon, we have a scenario where we see our parents as a demigod, where when they talk, we are not obliged to oppose them. So the children tend to have this kind of frustration and stress in them, and they feel like they want to talk out. But if they cannot talk out, they feel comfortable around friends, and they interact with them to release the stress they have. This made them now to get involved into drugs. And people have different reasons why they take drugs or they use substance. So that especially in Cameroon, you say they just want to fit in. They have what we call peer pressure. They want to fit in. If my friend is doing this, I know I can do it. If my friend is doing that, I know I can do it. So because they want to belong, they tend to use the drugs in order to associate with those friends that want them to interact with them. And some do it to feel good. Yeah, drugs has a way of making you relax. When you see them, when they take drugs, most of the times they smile, they laugh at you. Anything you tell them, they'll laugh and say, because of the pleasure that the drugs produce with them. And some do it to experiment. They take drugs to experiment. You know, as youth, we are motivated to seek we are just motivated to seek new experiences. We want to try new things. We want to know new things. And when we are exposed to that, it's common to find in a local setting, it's common to find people who can go into competition of who can take one bottle of spirit within a speed of light. It's very common. It's common to find people going into competition, like who can take a crate of drink within 2 hours. They bet their properties and money to do that. So that alone is a problem to our mental health. And some of the common drugs. Sevedi, can you just change the slide for me, please? Hello? Are we there? Sefedi? Fedi? Hello?
Your slide is on.
Just go ahead.
Yeah, your slide is on. Challote, your slide is on. Did we lose her again? All right.
Yes,
Okay,
I
looks
think
like we lost her again.
Yeah.
Oh, please, sorry for those for that difficulty. And I think we're actually going to. So I really appreciate the fact that you have been posting questions on the chat, and thank you so much, Sid, because you have been clearing out some of those questions very seriously. And so I want to just invite you to still drop those questions, because we will still be able to have the questions even after this session, and we can actually answer unanswered questions and send them on an email to you if you drop your email on the chat box. there's a team member who is collecting your emails from the chat box. We want you to drop your emails because there will be a lot of information to share to you after this. Please make sure you drop the right email. Double check your email before dropping it. Make sure you drop the right email. And especially for those who will be taking the post webinar survey as well. We really want you to take that survey so that we can be sure that we can make improvements also to the sessions and to everything we will be doing the National Youth NCD Action Network. So I think Chair is back. She has one more slide to finish, and let us give her the ability to finish it, and then we can take one or two pending questions. And that will be all for today. So your slides are up, Challote. Challote, are you there? Challote, your mic is on, but we can't hear you. Your slides are up. Okay. So I think we can continue the discussion.
Ferdinand, I had a question. Is it possible that our speakers would be willing to share their slides with us? Because particularly in view of Challote's problems with the connectivity, it might be very useful if we could see her slides after this webinar.
Absolutely. Absolutely. I think that's the way forward. We have to get those emails so that we can share information, including those slides. I'm happy that Sid is happy to share his slides as well. And I will get to Prof. Mbanya. I'm sure he's also willing and able to share his slides. Thank you so much, Dr. Farmer, for this. So I think we have come to the end of our time. We apologize that we have gone further than we initially planned to go beyond 5:30. But we thank you for your patience. We thank you for your patience in being with us up to this moment, and we hope that you have actually learned a lot. So I don't know if Nadege is back. We have one question for her.
Yes, I am on.
Okay, Nadege, okay. So Nadege, we had 49% of people of youth who are listening to us felt depressed and wish they were even never born. So because of this time of conflict and COVID and other mental health stresses in Cameroon, up to almost 50% of those who are listening to you have felt depressed and even wish they were never born. What do you have to say to them on this webinar?
What I have to say is that it is normal for many of us to feel depressed in one time or the other in our lives. It is not very uncommon for people to feel depressed. As a matter of fact, 5% of the general population have depression. It is very important for us to connect to a professional when we feel this way, just to get help. I know there is a lot of stigma revolving around mental health, making many of us not wanting to see professionals. And also in our context in Cameroon, many people don't know about mental health services. I really want to use this platform to encourage that consulting a mental health specialist does not reduce you from who you are or does not make you a psychiatric patient, as many would think. There are many facilities rendering mental health services. I work with Doctors Without Borders, and I am happy to share my contacts for people who would want to receive counseling by phone. And I have colleagues working in the Baptist Hospital as well, and also with Healthy Brain Cameroon, that would are available to provide remote counseling sessions for people who would want to. So as part of the emails, I can share contacts for people who would want to receive counseling services.
All right. Thank you so very much, Nadege. There are even more mental health support facilities in Cameroon that sometimes we do not know about. There is also, as far as I can remember, there's Living Hope, a mental health care unit in Bamenda, I think in Fonja Street. You also have, I think almost all the CBC facilities have a mental health unit or clinic. And then you have Jamot, I think Jamot in Yaoundé as well. And like we're saying, if you have these contact persons who are speaking to you today, you can always feel free to send in an email and ask information if you feel worn out, if you feel that you have issues you would want to get handled as far as mental health concerns are concerned, and then they can support you to handle those. So thank you very much, Nadege. I would like us to come to the close of our webinar of today. But before we do that, I would like to actually give a vote of thanks and then call on someone who is very special in our midst today to bring us closing remarks. And so as part of our thank you, of our vote of thanks, I just want to bring appreciations first of all to Professor Jean-Claude Mbanya, who devoted his time to be here with us today and to talk to young people as well. This is the kind of support we young people need and want to have from the elder generation that is supporting us as a future generation. I also want to thank Nadege for the input, the work she has done, and for being with us today. I also want to thank Challote, who has, even though facing difficulties, been with us. And Sid from India. This was an international webinar because we had you from India as well. And I also want to thank some of our leaders in the National NCD Youth Action Network. We have Rogers Ngani, we have Nelsa, we have Gayi Emma, we have Nadege, who are actually acting as our youth rapporteurs. They are actually taking note of everything that is going on here, and they are working hard behind the scenes to make sure that at the end of the day, we will have sparkling reports to share with you people and helpful information to share with you people about this webinar and the things that we have ahead of us. I also want to specially send this thank you to our collaborators from Kenya, specifically Damian and Laura, who supported us tremendously in making sure that we had this, the concept of this webinar straightened and worked out well. They really supported us in the network. And of course, to you all the participants for participating, I would like to appreciate you, but I also want to especially appreciate everyone who participated in the preparations leading up to this webinar. And we had a WhatsApp group where you people were wonderful. You did the pre-webinar survey and you shared information about the webinar, and that's why we have a great turnout today for youth in Cameroon. We also want to at least appreciate the media that is here. We already saw some of them posting questions, and we also have some of them who didn't post questions, but they are following up with what is going on and will be reporting in their different media houses. And last but not the least, before I hand over to Dr. Farmer, I'd like to appreciate her for taking her time to also and support us bring this concept and help youth in Cameroon to stand strong mentally through the stressors that we have. NCD Child should be proud of the work she is doing, even as a former chair of the NCD Child, and I'm sure the International Adolescent Youth Conference is also very happy with the work that she is doing in collaborating with us here in Cameroon. So after she gives the closing remarks, I will bring two major announcements, and then we will have an end to the webinar. Over to you, Dr. Farmer. Thank you so much.
Thank you so much, Ferdinand. Really, I want to thank you, Ferdinand, and RADA for doing such a wonderful job organizing great speakers like Siddharth and Dr. Mbanya and Challote, as well as also Anya. It was really wonderful to hear and learn about so much of what is happening in Cameroon, knowing that the work will continue, and know that we stand together, all of us, to help to make sure that the response to COVID-19, also the response for youth mental health, will remain strong and continue to grow in Cameroon. So this is really a first step as far as I'm concerned. I think that the contributions that are being made by each of the organizations represented by the speakers was quite impressive. And I am glad to note that many of us share in the concern and commitment to support RADA, not just in Cameroon, but in India and Kenya, the United States, Ghana, many, many countries. And we want to congratulate you once again. I think that, I think this is a great start, and I hope that we will continue to explore some of these very important health problems as it relates to not just Cameroon, but to young people all over the world. I'll turn it over to you for closing remarks and announcements. Thanks again, Ferdinand.
Thank you very much, Dr. Farmer. Just to let you know, Dr. Farmer's Zoom space was used for this session, and she was very kind to share her Zoom space with us, and we were able to use it this productively. This is what partnership means, and this is how we can actually bring support and assistance to one another across the world in making the world a better place. So I really hope that there is improved awareness on the negative impact of COVID-19 and crisis and substance abuse or misuse, social media issues on mental health. I think there should be some awareness among our participants today on what these things mean and how they affect our health, our mental health, and how we can actually be able to navigate against them. I also hope that we've been given some mental health support mechanisms or tips and pointed to where we can obtain some support for mental health issues and even refer other people. May I bring to your attention that almost 100% of the participants that responded to the pre-webinar survey indicated, for example, that they don't smoke or that they don't have a chronic NCD. But this is just proof to me that all of you in this webinar are part and parcel, you are ready and part and parcel of the change that we want to be able to introduce in our communities through advocacy and through the work of the National NCD Youth Action Network. So I still encourage you to sign up to the network and watch out for the things that we will be doing. I think we already have almost 100 people who have signed up to the national network, and we will be reaching out to you on exactly what the network means and what we will be doing in the network at your various levels. I also hope that you have understood the importance of youths as far as the resilience of our communities is concerned. If at the end of this webinar, you don't have a feeling like me, that youth are very important in changing the future of a country through what we do in our local communities and together across the country, then I think you probably need to listen to the recording of this webinar again, and you will catch that spirit. So I encourage you to understand the importance of youth, and that our mobilization for better well-being in our country, in our community is very important. So please feel free to send us an email at info@regdev.org. Send us an email, any question you have, contact on WhatsApp. We can get back to you and respond to your email, and everything I think will be fine. So thank you very much, everyone, for attending this session, and I wish us a very, very nice rest of the day.
Thank you, Ferdinand. Thank you, everyone. Goodbye.
Okay, bye-bye.
Thank you. Bye-bye.
I was so impressed with the presentations. Thank you.
Thank you so much. Thank you very much, sir.
Welcome.
Bye-bye,
Thank you.
Nadege.
Bye. Bye-bye.
Thank you for your wonderful presentation, Nadege.
Thank you very much for the
Thank you.
organization
Thank
and
you.
for the presentations. They're very beautiful. And I was happy to be a part. Thank you.
Thank you too.
Thank you.
Kiri.
Thank you for your
It's a
time.
pleasure to have you. Remember to drop your email address so that we wouldn't miss sending you the after webinar information.
Thank you. And if possible, maybe the recording of everything that we've discussed, because some of us came a bit late. We didn't have all the presentations, the audio.
Okay, great. That's right. The recording has been done, and we will be able to upload it on the RADA website, and you can get it on maybe other platforms. Yeah.
Okay. Thank you. Thank you.
I'm posting the email. You can send information to the email as well.
Okay. Thank you very much.
Laurie, thank you for joining from Germany.
Thank you. Thank you.
Joel is, I guess, is this Joel from the US? Thank you for joining from the US, Joel. Stephanie, thank you for joining from Barbados.
Baby.
Great. All right. Good night to everyone. Bye-bye.